On Monday, BC announced it will be delaying a second dose of vaccines by 4 months. Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, indicated that the province may be leaning in that direction. And if it decides to go that route, Shahab says everyone who wants one dose of the vaccine could get it by the end of June.
How can we maximize population protection? And the way we can maximize that is giving one dose to the vast majority of people by June, and then completing the second doses July onwards. And this will help us prevent a potentially devastating, variant-fueled, third wave, and will also maximize population-level protection at no sacrifice to individual protection, because that is critical as well.
The government announced that 91% of residents in long-term care have received one dose, 50% have received two doses. 90% of those in personal care homes have received one dose, while 43% have received two doses. Premier Scott Moe says if the province were to move to a one dose for everyone before people get two doses, would be a game changer for speeding up how the province is able to reopen. And he says vaccinations don't work if the majority of people don't get a shot.
When it is your turn and when you are offered a vaccine, there is only one answer that should come out of your mouth, and that is yes. They're all equally effective, the vaccines that are available, and a vaccine in our arm is far better than a vaccine that's sitting on the shelf or not being administered to someone here in the province.
Moe says the government is also looking at easing some restrictions, and he has his eye on one in particular.
The priority measure that I hear of time and time again, and I think in fairness one that I personally was hoping we could have made some movement on by now, but hope to in the very near future should everything hold steady for the next number of days, would be the one on expanding our households visits and our opportunities to see some family members in our households, and then move to the broader categories in the weeks after that.
The current restrictions expire on March 19th. Moe says the government will be looking at case numbers, test positivity, hospitalization, and testing and tracing capacity before making any decisions. Adam Hunter, CBC News, Regina.